Greetings, everybody. Welcome back to another episode of Black Health, brought to you by the Health Foundation of South Florida. I am your host, Dr. Michelle Kirwan Bythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. Black Health is a show that talks about health issues affecting the Black community. Most of the illnesses we cover truly affect anybody, not just people of color. But we spend a little more time on how the Black community is impacted or the health disparity in the Black community. Today, we're talking about a topic that truly affects people of color, more specifically, skin of color. We're talking about keloids, and we have board-certified dermatologist Dr. Andy Green with us today to teach us a little bit about keloids. Welcome, Dr. Green. Pleasure to have you on Black Health.
Glad to be here.
Absolutely. It's your first time, hopefully not your last time. Let me just introduce you. Dr. Andy Green is a board-certified dermatologist. He completed his medical school degree at the University of Miami and his residency at Jackson Memorial Hospital. Currently has his own private practice in dermatology here in Miami, Florida. Again, welcome, Dr. Green. And we're talking about keloids today. So let's jump into it. What are keloids and how do they differ from normal scars?
Well, keloids are basically fibroproliferative entities that result from excessive scarring.
So let's explain fibroproliferative. Hard to pronounce, and even harder to understand what that is.
Well, compared to a normal scar, there is more collagen in a keloid, and they're thicker, and keloids, unlike regular scars, tend to invade normal tissue. They do not respect the original injury. They tend to invade normal tissue. And the bundles under a microscope, the collagen bundles, are thickened and are more irregularly arranged than the orderly arrangement you would see in a normal scar.
So it's basically a scar that overgrows, that goes too far. And I believe we have here we go, overgrowth of scar tissue. Very good. Why are keloids more common in individuals with skin of color?
That is an interesting question. We're not precisely sure. We do know that you're more likely to have a keloid if you have a blood relative with a keloid. And among people of color, anywhere from 33 to 50% would have a blood relative that has that condition.
I didn't realize there was so many people. 33 to 50%, you said?
Right, of people with keloids have a blood relative with keloids.
What factors determine whether someone is prone to developing? Is it just that genetic factor, or are there other factors?
Well, keloids are more, if you have blood type A, you're more likely to have a keloid. If you have increased levels of IgE, which is an immunoglobulin, that a substance that occurs in your blood, really in people who tend to be more allergic, you tend to have more keloids. And sometimes it's also related to the certain locations: the jaw, chest, ears, upper back, shoulders.
Mm-hmm. And here we have a picture of a keloid of the ear, courtesy of Healthline. Our previous picture was courtesy of Mayo Clinic. So this obviously is probably an ear piercing that developed a keloid.
Exactly.
What types of injuries or skin trauma are most likely to result in keloids? So we have body piercings, ear piercings, and other piercings. What other types?
Well, for people who are susceptible, the truth is anything that injures the skin. You can get it from acne, mosquito bites. There are people who just develop keloids from wearing a necklace, and where the necklace rubs on the chest, the keloid forms. But typically anything that goes through the entire epidermis. So surgical scars, whether they be elective surgery, cosmetic surgery, tattoos, piercings, allergic reactions, anything that damages the skin can potentially result in a keloid.
Does inflammation contribute to keloid formation?
Yes, inflammation is very important in forming keloids, and usually in keloid formation there are high levels of inflammatory elements that are found within there, and that's why it creates extensive fibrosis, and which leads to the enlarged shape, the redness that is associated, and some of the symptoms that you experience, like the burning, the itching that come with keloids.
That was actually my next question, are some of the symptoms. So let's review those again. You said burning, itching,
pain.
Pain.
Yes. Even from stiffness of the skin, depending on the location. Yeah. Yes.
Yeah. Okay. Are there any conditions that can be mistaken for keloids, especially in darker skin?
Well, there is actually a skin cancer known as a dermatofibrosarcoma that looks pretty much like a keloid, and the only way to tell is by doing a biopsy. That is usually mistaken for a keloid and only found to be a skin cancer upon doing a biopsy. I myself have had times when I've gone into to excise what I thought was a keloid, and it turned out to be something else. I've had cysts that look like keloid, lipomas, different entities that appear to be keloid, but when you try to surgically remove it, you realize that it's something else.
Interesting. So how do you then diagnose a keloid? Is it just once you go to excise it, you realize it might be something else, or
not really? I mean,
do you typically biopsy them, or
not really? But what I'm saying is, usually you can tell by history and by your physical exam if it's really, keloids tend to be hard, even though some can be quite soft, tender, but normally they're solid entities. They're not. Some people think they're things inside and that they can express them, but keloids are really solid. They're basically a benign tumor. Like I said, it's called fibroproliferative. So there are a lot of fibroblasts of collagen cells in there, sometimes blood vessels. And these are the things that make them larger and lead to some of the symptoms that we just described.
Okay. So let's talk, and I'd like to spend a little bit of time here until our first commercial about treatment. What are the current standard treatments for keloids?
Well, there are quite a few standard treatments. We generally divide them into non-invasive and invasive. On the non-invasive side, you're looking at things like silicone sheeting, topical steroids, some other creams like imiquimod, which is an immune modulator. And these have shown some promise in preventing keloids and treating some of the smaller ones.
What exactly is silicone sheeting? The others you mentioned are creams, the steroid cream, the imiquimod cream, and I presume those creams would shrink the keloid. What is silicone sheeting?
Silicone sheeting is just a sheet of silicone. That's all it is. And honestly, we really don't know why it works. Most people assume it's because it traps moisture underneath, and moisture helps the wound heal. And it may also protect from further irritation because it creates a barrier on the outside. In my clinical experience, I really haven't found silicone sheeting to be that effective, honestly, but it's always mentioned in books and whenever you do research. But in reality, it's not something that I use too much.
Okay, we're going to pause and put a pin right there. Dr. Green, we need to pay some bills, so we are going to take a quick commercial break. Black Health is brought to you by the Health Foundation of South Florida. We are talking about keloids with Dr. Andy Green. We will be right back.
February 20th to the 23rd, join us at the Food Network South Beach Wine and Food Festival.
This is a world-class food and wine festival. I don't think there's anything like this.
Proceeds benefit FIU.
Eat, drink, and educate.
Get your tickets now at SoBWFF.org.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman and Dover Law Firm, youraccidentattorneys.com.
Welcome back. You are watching Black Health, brought to you by the Health Foundation of South Florida. Today we are with Dr. Andy Green, board certified dermatologist, and we are talking about keloids. So, Dr. Green, you were mentioning some of the topical treatments for keloids. How long do those treatments take place before you see some effect or some improvement in the keloid or complete remission of the keloid, if that's possible, with topical treatment?
Okay. Well, before we get to that, I had omitted one of the other non-invasive treatments, which is like compression, particularly in the ears, where they can use compression earrings to help prevent or reduce keloids. But as normally, you can see effects from as early as 1 week.
Oh, wow.
But really within 1 to 2 weeks, you begin to see some effect from the topical treatments. And this can extend, and they can be used for months.
Okay. And do they typically shrink the keloid all the way down, or?
Well, depending on the size of the keloid, most of the treatments really tend to be more effective if they're either used early or after the keloid has been removed to help prevent recurrence.
Okay. So let's go into some of these were the non-invasive treatments. I presume there are invasive treatments. I know there are invasive treatments. So let's talk about those.
Well, the more invasive treatments, you're talking about intralesional steroids, which is when you inject liquid steroid directly into the keloid to shrink them. Also, you can inject other things apart from steroids, tacrolimus, fluorouracil, which are anti-metabolites that are sometimes used in some form of cancers. Also, there's radiation, but typically that is really used as an adjunct treatment after removal of the keloid to prevent recurrence.
Okay. So how do you decide between, let's say, injecting steroids into a lesion or surgical, topical, or do you maybe use all of them, inject, and if that doesn't work, surgically remove and then use the creams to finish it off? Or how do you decide what to do?
That's a very good question. A lot of it depends on the patient as they present. If they're brand new and it's a newly forming keloid, you're more likely to use the non-invasive methods. If they've had this problem for years, they have tried other treatments, then basically, and they haven't worked, then it makes it easier because you basically use the method that hasn't been tried. Okay. For some areas, like the ears, on the earlobes in particular, usually the best approach is to surgically remove it. Now, if you remove it surgically without treatment, there's a 50% chance that it would recur. But if it recurs, it's always going to recur. So I always tell patients when I remove a keloid, I'm like, when we're done, everything's going to look fine. It's perfect. But that is not the end. This is just the beginning. It's a process because they get so happy. Everything's fine. They disappear. And then 3 years later, they're back and the keloid is there. I actually have one patient that's for 10 years. She would come in, I would remove them, never come back for follow-up, but every 3 or 4 years would show up and want them removed again. So it is a process, and sometimes you tailor your approach to the patient. Some people don't necessarily want to try an invasive procedures because of pain, discomfort. Sometimes they have fear of having invasive things done. So you really tailor your approach both to the patient. You consider cosmesis, you consider cost, you consider a number of factors to tailor it to the patient. So it's
And what is the risk of recurrence after treatment? Do majority recur or 50-50?
yes. So because keloids are genetic and we're not really changing their genes, I mean, we don't have that capability, more than likely, without some sort of maintenance treatment left on their own, they will recur. But there are times when they're done because keloids, the recurrence or the occurrence of keloids tend to peak in the second and third decade. So as we get older, once you get beyond the third or fourth decade, your chances of forming keloids actually go down.
After beyond which decade?
Third
decade. Okay. All right. I'm safely out of the keloid.
No, you're not. You're still in the keloid range.
I am.
So, but
I'm a little bit beyond 30.
but there's something to it. It's one of the few benefits of going beyond that time frame. If you have keloids, the chances are become more quiescent. The chronic ones shrink a little bit more, and your chances of forming them go down.
Okay. I don't know. I might trade some of these older age problems for a keloid or two. I don't know. I'd have to think about that. Okay. So we talked about, their formation and their recurrence. How can somebody prevent getting a keloid, or is there a way to prevent? I mean, obviously, if it's going to happen, it's going to happen. Are there ways to minimize your risk of developing them or them recurring?
Of course. I mean, there's some common sense. I mean, obviously, trying to prevent getting injured is an obvious thing. But if you get injured, you want to treat the wound immediately, wash it, soap and water, apply a hydrogel dressing or petrolatum dressing, keep it clean, keep it bandaged, apply pressure, and that should minimize the risk of getting things done. If you're going to have surgical procedures, you want to minimize use of sutures if you have to. Put fewer deep sutures in if you're prone to keloids, because those create an area where you can get chronic irritation, which can lead to inflammation and to keloid formation. You can also do, if you're going to get tattoos, before you get a large tattoo, get a test spot, get a tiny tattoo in a less conspicuous location to see how you respond. And let that guide you as far as if you're going to get a larger tattoo. And also that the choice of ink can have an impact, because if you're allergic to a particular metal, like copper is generally for green colors, iron for red or black, cobalt for blue. So these are things that you should, if you can do a test spot to see how you respond, can help mitigate forming keloids if you're getting tattoos or piercings. And of course, for elective surgery or cosmetic surgery as well, you need to keep that in mind. So there are times if you really don't need to have a surgical procedure done, maybe consider not having it done, because the cure shouldn't be worse than the disease.
How about with acne? I mean, I guess you started off saying wash the area, apply pressure to it. Is it going to be the same thing with acne? I mean, obviously you want to prevent the acne. You want to treat acne, but...
Well, in people who are prone to keloid, you probably want to be a little bit more aggressive in your acne treatments so that they don't progress to that level. If you have cystic acne, treatment with Accutane relatively early. Okay. Normally, in most people, you want that to be your last resort. But in someone who's prone to keloids, you'd probably want to consider that a lot earlier as a treatment option than otherwise.
Okay.
A lot of it boils down to common sense and tailoring whatever your approach is to the particular patient and their family history and their own unique circumstance.
Okay. Andy, I'm sorry, Dr. Green, this show runs so quickly. We do have another commercial break. Black Health is brought to you by the Health Foundation of South Florida. We are here with Dr. Andy Green, board certified dermatologist with his practice here in Miami, Florida, and we are talking about keloids. We will be right back.
February 20th to the 23rd, join us at the Food Network South Beach Wine and Food Festival.
This is a world-class food and wine festival. I don't think there's anything like this.
Proceeds benefit FIU.
Eat, drink, and educate.
Get your tickets now at SoBWFF.org.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Welcome back to Black Health. We are here with Dr. Andy Green, dermatologist, talking about keloids. Dr. Green, I think we would be remiss in not speaking about the emotional and psychological toll that keloids can take on a patient in terms of self-esteem and body image. Can you talk a little bit about that?
Well, that is a very important aspect of keloid formation. It's not just what it means clinically, but it's the effect it has on the patient. And this is not just keloid, just with any condition. Some conditions may not seem as important to the physician, but the impact on the patient can be extreme. And it is always important to ascertain the impact that it has on the patient, because that can direct how aggressive you will be in approaching different treatment options. And it's something that I always incorporate into my treatment algorithm. You try to determine the psychological impact, how the patient feels about it, because sometimes the psychological impact is more important than the pain or the itching or the swelling, and the location as well. So if it's on the face or on the chest or areas that are more visible, it can have a deeper impact on the individual. So sometimes it's also important to refer such an individual for counseling, things that are really apart from the clinical treatment of the keloid itself. Sometimes you actually need to treat the psyche of the patient as well. The factors that make a person more likely to have keloids. As far as new treatments, there are some on the horizon. We had discussed, of course, in addition to intralesional steroids and radiotherapy, there's also more superficial radiotherapy where you're using less high dosages of radiation. Use of lasers also to mitigate keloid formation. Most of these lasers really target blood vessels, and by shrinking the blood vessels, you're kind of reducing the amount of inflammation that occurs in the area and reduce the size of the keloids. There are new classes of medications that have been recently discovered. There's a Janus kinase inhibitors known as JAK inhibitors that have been used for a number of things, inflammatory conditions, other inflammatory conditions, rheumatoid arthritis, psoriasis, atopic dermatitis, and a lot of these treatments may also have some impact on keloid formation. So a lot of these are being considered and being tried right now. So we don't know yet extent of their effectiveness, but it's an exciting time because there are a lot of things that are available right now and in the future for treatment of keloids.
Is there anything specific, or what should patients look for when they're looking for a dermatologist to treat keloids? Just you, or is there anything in particular that a patient should look for?
Well, there are things. One, you want to choose someone that you're comfortable with. Mm-hmm. So a lot of complaints I hear with patients is that they go in and they don't even really have time to express or let doctors know what's going on. They're in, they're out. So it's important that we create a little time so our patients can feel comfortable telling us what's really affecting them. I think there are some dermatologists who actually have a special interest in this. As when I was a resident, I remember our chairman suggested to each of us, I remember, that you should pick one particular disease and become like the ultimate expert in that particular disease, just as an interesting, based on your own interest. Yeah. And I remember I had chosen something to do with keloids, acne keloidalis, which is a subset of keloid forming diseases, normally from shaving and ingrown hairs and things like that. Yeah. But it's basically a keloid, just basically caused in the hair-bearing areas. And because of that, you take a particular interest in these things. You keep up to date on changes and advances in those sort of things, and that is something you can bring to your practice. I mean, I see a lot of keloids because in addition to being a dermatologist, I'm also a board-certified micrographic dermatologic surgeon. So
I didn't know that.
Surgeons all the time, and it's I do a lot of, in addition to acne keloidalis and skin cancer, and of course the sequelae of treating skin cancers is formation of keloids as well, and different types of scars. So they all kind of interrelate.
Dr. Green, we are at the end of our show. Can you tell our audience quickly how they can reach you if they have keloids or other concerns, dermatological concerns that they'd like to reach out to you about?
Okay. I mean, I can be found easily on Google. I've been in my current office for past 24 years. I'm a creature of habit, so I'm not really going anywhere. But North Miami Beach, Andy Green is very easy. You just Google it. I'm there.
Awesome. Dr. Green, thank you so much. It's a pleasure to have you on Black Health. A little known fact, or well-known fact probably, but Dr. Andy Green and I did medical school together, so we go way back.
Even though you will not be able to tell by looking at both of us, she looks like she did it a long time after I did, which means she was an infant in our class, actually. But it's nice to see that she has grown up, and I am extremely proud of the work that she does in the Black community and continues to represent us all.
Thank you. And likewise, Dr. Green, thank you so much for being here on Black Health. Thank you to those of you who tune into Black Health, and we will see you next time. You can find me on IG at Black Health Show. Take care, everybody. Have a wonderful week.
Thank you.